Your time 4 minutes. And
Good afternoon. I would like to thank the Scientific Committee of APAO and AIOS for giving me this opportunity. Clinical profile of open globe injuries at workplace, a study in a quaternary care institution. As we all know, ocular trauma is the most common cause of ophthalmic morbidity and monoocular blindness, with globally 55 million eye injuries occurring yearly, according to WHO estimates, with a cumulative lifetime prevalence of ocular trauma as 20%, that is 1 in 5 persons. Most patients with open globe injuries are men, and the occurrence is at workplaces. Various factors influences the prognosis, which includes pre-op visual acuity, presence of relative afferent pupillary defect, and the location of ocular trauma. The ocular trauma score is a prognostic model developed, which factors in considerations are the best corrected visual acuity, globe rupture, endophthalmitis, perforating injury, retinal detachment, RAPD. The aim of the study was to study the clinical profile of patients presenting with occupation-related open globe injuries. The methodology design was a prospective observational study, and the inclusion criteria were patients presenting within 1 month of injury at the workplace and those above 18 years of age. And the staffs and students of Christian Medical College Vellore were excluded from the study. Out of a total of 88 patients, we had 11 patients, or 12.5% of patients presenting with open globe injuries. All patients with open globe injuries were from the lower socioeconomic strata according to the modified Kupusamy scale. Open globe injuries were more common in those with primary school education and those with higher risk for presenting with worse vision. The metal foreign body was the most common cause of injury in the industrial sector. This was followed by welders and those involved with grinding metal or stone. Out of a total of open globe injuries of 11, we had 4 patients with retained intraocular foreign bodies. The profile of ocular injuries is illustrated in the table, and the cause of low vision at 1 month presentation were due to vitreous hemorrhage, retinal detachment, corneal scarring, and aphakia. Now, this is a table of profile of patients with open globe injuries with retained foreign body. The first patient is that of a mason who, with injury occurring to the eye as a result of hammering a nail into the wood, and the nail chip flew. He presented with a vision of 260, and at 1 month follow-up, he had a vision improvement of 636. The second case is of that of a stone quarry worker, and the injury occurred while hammering stone. He had a presenting vision of 6.9, and it remained the same. The third patient was that of a grinding worker who, with the injury of grinding stone with a machine. The vision was poor of perception of light, which remained the same at 1 month follow-up. The fourth case was that of a truck driver who was working in a stone quarry, and the blast injury occurred at workplace. His vision improved from 636 to 66 at 1 month follow-up. This is a profile of patients with open globe injuries with no retained foreign bodies. And the profile of patients were that of farmers, stone quarry workers, and mechanic and electrician. The patient, the farmer who incurred open globe injury due to cutting branches of the tree, his vision improved from hand movements to 624, while that of the electrician, it improved from 618 to 69, and the injury had occurred while cutting metal wire. That of the stone quarry workers, the vision were poor in both the patients with hand movements at the time of incidence, and one patient improved to 612, while the other patient did not improve. Then we had 2 farmers who presented with perception of light, and their vision improved to counting fingers at 1 month presentation. Case 7 was that of a mechanic whose vision improved from 160 to 612, and the injury had occurred while chipping metal. The last patient is that of a farmer whose vision improved from 636 to 618, and the injury had occurred while working with stone and stone quarry. In discussion, I would like to say that closed globe injuries are more common than open globe injuries, and the most common is that of a metal foreign body in the industrial sector, and that of vegetative matter in the non-industrial sector. Most patients will have an improvement in visual acuity following surgical intervention. Final visual acuity after open globe injuries can be better than 20/14 up to 39% of patients, and the visual outcomes were consistent with that of the ocular trauma score study. And the incidence of open globe injuries are decreasing with more rampant usage of personal protective equipment. Occupation-related trauma is a preventive cause of injury, and most of these injuries occur in the unorganized sectors and those like stone quarries and domestic animal owners. Public health awareness and use of safety devices is of utmost importance, and adherence to stricter national laws is important, and this needs to be included in the public health agenda. PPE usage, according to various studies, has highlighted the importance of decreasing the incidence of open globe injuries. With this, I conclude. Thank you.
Thank you. You were mentioning about the open globe injuries. That's your topic is.
Yes.
So you mentioned a lot about the foreign body, metallic foreign bodies or vegetative matter.
Yes.
So did it really go, was it intraocular?
No, the foreign body, the vegetative matter was not intraocular.
Right.
We had included a study of 88 patients, which included both open globe and closed globe injuries, and
basically
we used a subset of.
So basically
11.
the open globe includes, basically it means intraocular.
Yes.
So I feel, personally I feel that it can't be included in your, should not have been included in your topic, like a foreign body, metallic foreign body. Did it penetrate the cornea?
Yeah, we included only those that have penetrated the cornea.
Ashish?
When was, though your study is on the clinical profile, but you mentioned the final visual acuity, what was your intervention, and did anybody had infection or anything, and what was the time interval of intervention? That is something that should have been mentioned in this.
Yes, so with the patient with vitreous hemorrhage and retinal detachment, we intervened immediately within 2 to 3 days, and the final visual acuity was taken at 1 month presentation.
And the foreign bodies, retained foreign body use?
Yeah, that was also
how
taken.
long was it retained?
We operated within 3 days.
3 days.
Yes.
Size of the foreign body was not mentioned there?
It was about 2 to 3 centimeters.
Any of these patients had an infection when you were doing the surgery, or did you give intravitreal antibiotics?
We did not encounter any infection. We had given intravitreal antibiotics, but we didn't encounter any infection.
So I must say that you've actually presented a good clinical profile of open globe injuries, which have been both farmers, the industrial trauma. But I would say that specifically in these subsets, what you need to do in these cases, any take-home lesson for that, if you could, convey to us, that would be even better for the study.
Yeah. Over the years, I felt that protective eye equipment has not been incorporated in all these sectors, and we still see patients who have incurred open globe injuries and also closed globe injuries with metallic foreign bodies. The reason being that they've not been using protective eye equipment, and the companies or the sectors where they're supposed to encourage workers to use protective eye equipment are not encouraging them, and some of them are not even doing it maybe out of ignorance. I feel that this is important, and this needs to be included in the national agenda, public health agenda also, because most of these injuries, they go unnoticed, and